Good morning, not so much morning, good evening.
Welcome, everybody.
Afternoon.
Nice to see you all.
Hi, everybody. My name is Borislava Ananieva. I am the EPF Capacity Building Officer. I'm also a patient myself. I'm also an active patient advocate and many, many more things. And it is my absolute pleasure to welcome you today to the EPF Congress 2025.
And I'm Ruth Triparian, Strategic Partnerships Senior Manager. We're very pleased to welcome you to EPF's third Congress. And thank you for joining us in person and online, despite the strikes, despite the fact that we're in Mercury retrograde. It's been a pretty interesting month for many people. So, in previous editions of the EPF Congress, we had covered advancing meaningful patient involvement. We also covered the digital transformation of healthcare. And this year we're focusing on shaping the future of healthcare and preparedness for health system resilience.
So why are we actually gathered here today? Maybe it's because we care about the future of healthcare. Maybe it's because we want to see a more well-prepared health system in the future, or because we want a resilient future health system for all patients in Europe. I think it's all of those reasons. We will have 2 days of dialogue, collaboration, and advocacy towards a future where healthcare systems are resilient, inclusive, and patient-centric, hopefully.
Indeed. So today we will take stock of the current situation and identify challenges, and tomorrow we'll look at innovative solutions and transformation. So let's take a quick look at the agenda for today.
Well.
That's us. Looking good, Bori.
Well, thanks. You too, girl.
Well, thank you.
Next slide,
Next
please.
slide, please. Thank you. So coming up next, we'll have the pleasure of hearing a keynote speech by our EPF board member and treasurer and youth group alumnus, Andreas Christodoulou, as well as some reflections from an EPF youth group member, Erato Mercantoni, an active advocate and also a medical student.
Something very unique about the Congress this year is that each plenary will be opened by an EPF youth group member, which I'm so happy about. After all, we can't really talk about the future without including young patients in it. After the keynote speech, we will have our very first plenary focusing on a topic we would all actually, I think, rather forget, but it's still important to take some lessons from it. So COVID-19, our favorite thing in the world. Believe it or not, it has already been 5 years. So it's been a long time since it happened. And we're asking the question, have our health systems actually recovered after this?
So then following the plenary, we'll have a short but much-deserved coffee break. And it's just outside in the lobby, outside these doors here. During the networking breaks, you'll also have a chance to look at some posters, a selection of showcase posters. These are presentations of projects that EPF is involved in, as well as our members and also some other patient organizations. And each poster will be accompanied by a colleague who will be happy to answer any questions that you might have during the Congress.
After the coffee break, you will head to your selected workshops to which you have registered beforehand. We have prepared 3 unique workshops focusing on topics such as antimicrobial resistance, preparedness, public health and the environment, and the EU budget, asking the literally €1 million question, can the EU budget drive a resilient future?
Then straight after the workshops, we'll welcome you back here. This is called the Sycamore Ballroom, where we will reveal the preliminary results of the first ever barometer on patient involvement in national health policies and discuss them with member states and national coalition representatives, which we are very excited about. And then after that, it's back to us and you, the audience, and we'll reveal more about that later. Following a very full day of fruitful discussions, we'd like to invite you back to the lobby for a networking cocktail from 6, and then we'll have the dinner back here in the ballroom.
And now that we covered all of this, we would like to go through some housekeeping rules for our guests who are here in person, because the event is also being live streamed on YouTube. Something to note.
Smile, everyone.
So first of all, please wear your badges at all times in order to be recognized as a part of this event. They asked us from the hotel to make sure that all of our guests wear their badges all the time, so please don't take them off until the day is over. Secondly, one of our participants has a severe allergy to fragrances, so we kindly ask you to refrain from spraying or applying any fragrances during the Congress. We are well aware that it might have already been the case that some of you applied fragrances. Please refrain from reapplying them as the day goes by. Next thing I wanted to mention is that you can find all restrooms, including the accessible ones, on the ground floor just after the coffee break area here on the right. Our right, your left. In case of emergencies, you will be notified by the EPF staff and the hotel staff, and we would like to ask you to calmly proceed to the emergency exits at the back, where you can see in the room, or here. Both of them lead to Place Rogier, yep. Yes, where we'll be gathering if, of course, something happens. Hopefully we don't need to use that. The first aid kit and the first aid staff are at the reception of the hotel. Hopefully also we don't need to use that, but just in case, please be aware that you can find that at the reception. Please note that the Congress is being live streamed on YouTube, and online participation, unfortunately, will not be moderated. We will also have a photographer present, as you might have seen, to capture the Congress, and those who have not consented to have their photo taken have a little sticker on their badges, so please refrain from taking pictures of people with a sticker on the badge.
Thanks, Maureen. Just a few more. Please sign in on both days. If you haven't signed in at the registration desk, please do so. And do keep your badge for both days. On your badge, you have a little QR code, and that will take you to the agenda. But you also notice that you have written down the workshops you'll be attending, the dinner, etc. If you would like to leave your lanyard, you can do so. Drop it off at the registration desk when you leave tomorrow. If you do need an EPF member of staff, we are the ones with the blue lanyards. Very recognizable. And as we do have a very rich program ahead of us, please try and keep to timings as much as possible. You will hear a little bell ringing in your ear to tell you to move to the next session. So listen up for that.
Very calm way
as it
to
says
notify
here,
you.
If you hear a bell after coffee, it's not an angel getting its wings.
Yes.
It's your cue to return to the session.
And thank you very much in advance for keeping that. Now, on your seats, you had a piece of paper that says EPF Bingo at the top. The game is very simple. You have to read the prompts and cross a square when it happens during the Congress.
Also, if I forgot to say, any questions at all, we have our fantastic colleague, Isabella Picotto,
over there,
who organized all the logistics to the Congress. So huge congratulations to you, Isabella. We're in very
amazing
capable hands.
work. Amazing work.
So any questions at all, she is your lady. So yes, regarding the bingo, a little prompt. Soon you'll hear a speech from a youth group member, and there might be something on your bingo card related to that. So,
no
cheating,
cheating, please. No cheating. Just keep it, if you hear it, square it off. That's it. Once you cross off all the boxes, feel free to shout out your bingo. Or, of course, you could, be polite and wait until the end of the session to shout it. But shouting a bingo in the middle of a session, I think, is also acceptable, So
we're amongst friends. So yeah, once you have your filled out card, please take it to the registration desk, and the first 10 winners will be awarded a prize. So stay attentive.
And again, please don't cheat. I know some of you here, so please don't cheat. All right, next, we would like to take this moment to sincerely thank all of the contributors to today's event. Of course, the EPF staff who have done an amazing job with everything so far, and for their hard work and making the Congress happen. Don't forget to follow us on LinkedIn, X, Instagram, Facebook, wherever, just everywhere. Follow us everywhere, please. Where you can live stream updates, you can see live stream updates from the Congress, share with your peers, and so on. You can use also the hashtag EPF Congress 25 altogether. when posting your social media on your social media channels, and we would love to see the event through your eyes with your key takeaways. I think it would be fantastic. And also, when you use the hashtag EPF Congress 2025, just 25, no 2025, EPF Congress 25, you will be featured on our social media wall, which will be shared here on this screen during the breaks, so coffee breaks and so on. You can come here, take a picture of your own post, if that's something that you want to do, and just enjoy seeing your amazing creations online.
Brilliant. And of course, we'd also like to thank our fantastic sponsors who helped make this possible. So thank you so much.
Yes, sorry. I think that's enough from us from now, and we would love to actually hear from you. So what I would like to ask you to do is turn to your neighbor and share one of 3 answers. Next slide, please. So the topics of discussion can be, what is your dream healthcare innovation? Dream big. Just whatever it could be, whatever is your actual dream of healthcare innovation, share that. It doesn't have to be very realistic, you know. A personal goal related to healthcare, what you hope to achieve in the next decade. So you can pick one of those because you only have 5 minutes, unfortunately. So turn to your neighbor, discuss one of these, and then my lovely colleague Ruth is gonna hunt down 2 of you to share their answers. So please, 5 minutes, no more, and then we'll see who shares.
We might actually have to cut it a bit short because we're already running out of time.
Oh, yeah.
2 minutes,
Oh
2
my God,
minutes.
2 minutes,
2
go
minutes.
guys, go, go, go.
It's already 40 minutes. Okay, start wrapping up your conversations, please. Thank you. Okay, my first victim.
Thank
Hello
you
there.
for sharing. Maybe it's time to be quiet now.
We're ringing that bell. Hi there. What did you share with your neighbor? Would you like to share with us?
My dream for healthcare innovation actually was even a broader dream. I wish that we had platforms where we could share truthful information and have that being recognized and fight disinformation.
Absolutely, very valid indeed. Thank you so much. Next victim, who would like to volunteer? I'm coming to you.
The thing I shared was that it's a bit specific, but I'd like a self-evolving antimicrobial technology, not necessarily a drug specifically, but something that can out-evolve evolution. My new friend said that she would like a fairer system within Ireland so that people had more equitable access to healthcare.
Absolutely. Fantastic. Thank you so much. Let's see what other solutions we come up with today as well. Thank you, everyone.
We would love to hear from all of you, but we really don't have the time as there is a packed agenda. So I think we can get started at this point. It is my absolute pleasure to introduce to the floor Andreas Christodoulou, Director of Operations at the Cyprus Federation of Patients Associations, EPF board member and treasurer, and also most importantly of all, ex-youth group member, ex-youth group president. Yes. To open this year's Congress with our very first keynote speech. Andreas, the floor is yours.
Thank you. So, good morning to everyone. So I need to follow that. And I will try to be brief. Bingo hint. Just saying. I don't know what that word I'm saying. So, it's a true honor to open this year's EPF Congress, a gathering that brings together voices from every corner of the healthcare ecosystem. Each of us here represents a piece of a much larger picture, one built on a shared purpose, resilience, and the belief that patients are not just participants in healthcare, but essential partners in shaping it. When I first joined EPF Youth Group, almost a decade ago, so I'm not that young anymore, I was a young patient searching for connection and a sense of agency. Today, standing before you as EPF's treasurer and director of the Cyprus Federation of Patient Associations, I am and I feel profoundly grateful and proud because my own journey is a proof of what empowerment, mentorship, and trust within this community can achieve. Like many of you, my story began with a diagnosis. I was 16 when I got my first diagnosis of a cancer diagnosis. It brought fear, but also perspective and deep understanding that healthcare is not only about treatment, but about dignity, empathy, and access. EPF gave me a platform to turn experience into advocacy through partnerships between patient organizations and government, and of course through the youth group. I learned the power of collective voice, and that patient involvement isn't about being invited to the table, but about shaping the agenda. As I mentioned, today I'm the Director of Operation of the Cyprus Federation of Patient Associations, which will represent around 80,000 patients in Cyprus and 42 full member organizations. I see those principles, the same principle that I mentioned before, in action, through partnerships between patient organization and government, in digital health, access to medicines, and national health reform. My story, like so many of yours, is not about one individual. It's about how this movement lifts people, connects them, and changes systems from within. And yet, as we gather here today, we do so at a challenging time for health in Europe. 2025 has been a defining and at times difficult year for the European health agenda. We have seen political turbulence, competing priorities, and even backlash as competitiveness increasingly becomes a guiding vision rather than a positive side effect of healthier societies. Civil society organizations have been hit hard, not least as a direct casualties of the EU for Health program cuts. National systems are also stretched by financial pressure, workforce shortages, and growing inequality in access to care. And while policymakers debate, patients' organizations are under increasing strain, asked to do more, to engage more deeply, to represent more voices, often with fewer resources and less structural support. This is why gathering like this, like the EPF Congress, which is really important to us, matters, as I mentioned, so much. Because when the landscape is uncertain, our collective voice must be stronger, clearer, and united around one truth. We, patients, are not a cost. We are the purpose of every health system. Health does not exist in isolation. It is an ecosystem, one that connects policy, innovation, practice, and lived experience. When one part of that ecosystem weakens, the whole system suffers. That's why we need stronger collaboration across sectors, between regulators and innovators, professionals and patients, policymakers and communities. We need to reorganize and recognize that patient organizations are an integral part of this ecosystem, not as observers that we hear a lot, but as an active contributors of evidence, insight, and accountability. EPF has always embodied this vision, an ecosystem where the patient experience informs research, where innovation serves humanity, and where inclusion is not a slogan, but a standard. So, I invite you all, as we open this Congress, I ask you to see the next 2 days as more than a program, but as a shared commitment. A commitment to rebuild trust between us, to strengthen the ecosystem that connects us, to defend the space for health in European policy, and to build a future where patient organizations at all levels have the support, resources, and recognition they need to keep doing their vital work. And of course, to keep pushing for a Europe where every policy, every innovation, every reform starts with one question. And that question is this: what does this mean for patients? That question guided me personally when I joined EPF as a young patient. It still guides me today, and it will guide us together as we build the future of healthcare, one that is truly for, with, and by patients. Thank you for your time. And now we are opening the Congress officially. I'm inviting Ms. Nicola Bedlington for the next plenary session. Ms. Nicola, thank you.
Very much, Andreas, and that was a very inspiring, very, very uplifting keynote speech. Thank you. So good afternoon, ladies and gentlemen. I'm delighted to welcome you all to our first plenary session of the EPF Congress, entitled COVID-19, 5 Years On, Have Our Healthcare Systems Really Recovered? My name's Nicola Bedlington, and it is an absolute honour and pleasure to be moderating this session. It's a really exciting panel discussion with very diverse and excellent experts, and I'd like to briefly introduce you to each of them before we move on to the next part of the programme. So Erata Marcantoni is a youth group representative and a very active patient advocate, and we'll hear from Erata in a few minutes. Dr. Oli John-Backer, who is joining us online, is the president of the Standing Committee of the European Doctors Association, CPME. Pierre-Yves Brevet is the Senior Manager for IV Diagnostics at MedTech Europe. And we have Marco Corignac, who is President of the European Liver Patient Association. Professor Karine Lacombe from Sorbonne University, who's also joining us online, and Georgos Rosidis, who is responsible for international relations at HERA, which is the Health Emergency Preparedness and Response Unit within the European Commission. And last but not least, we have Willie Palm, who's the Senior Advisor in the World Health Organization's representation to the European Union here in Brussels. A very warm welcome to all of you. We're absolutely thrilled to have you here, both those here in person and those of you who are joining online. And of course, you have many more details in the bios in the website to look more into these fantastic speakers. So our focus for the next hour or so will be to draw on lessons learned from the COVID-19 pandemic, and crucially, how these learnings can really be channeled into Europe's ability to respond to health crises without threatening or undermining patient safety and continuity of care. So before we get into the panel discussion per se, I would first like to hear from Irata, who's from the EPF Youth Group, this vibrant group of young leaders from across Europe, really doing a sterling job with and for EPF. So Irata, please share with us your experience of the pandemic and your key recommendations to policymakers to ensure that preparedness strategy of today don't fail young generations of the future. And I'd also love you to touch on the importance of inclusiveness, inclusive healthcare in times of emergency, because that goes to the very heart of what EPF's all about. So, Irata, the floor is yours, and if you'd like to come up to the stage, a warm, warm welcome.
Thank you very much. Thank you for the introduction. Hello, everyone. And thank you for the opportunity to speak today amongst leaders in patient advocacy, policy, research, and industry. My name is Erato Marcandoni, and I'm here as a young advocate and member of the European Patients Forum Youth Group. We're a group of young patient representatives aged 18 to 30, and we're working to bring the priorities and expectations of young patients across Europe at the forefront of EPF's work. Personally, I joined the youth group 5 years ago with my brother in mind who has cerebral palsy. And as all of you have experienced 5 years ago, the pandemic disrupted every dimension of care as we know it. Hospital visits were canceled, medical supplies were delayed, and therapies became harder to access. When health systems bent under pressure, chronic conditions did not pause. I saw how my brother's care was affected. And for him and for young patients around the world, the fear was twofold. One, getting COVID itself, and the risk of being cut off from the care that sustains them. And if we ask today, have our health systems recovered? The answer is partially yes, and yet no. We've made real progress with HERA being created in 2021, which has strengthened our ability to act quickly in a crisis. The 2022 Serious Cross-Border Threats Regulation improved surveillance and joint procurement. And this summer's medical countermeasure strategy set clear priorities so that essential supplies are ready for the next emergency. But gaps still remain. We have plans on paper, but our coordination, our workforce resilience, and data sharing are still weak points. Yet amid those weaknesses, young people showed what true resilience is. We use our digital skills to stay connected with the rest of the world and support our communities, bridging the gaps where systems fell short. So from a youth patient perspective, how do we strengthen preparedness? Firstly, we need to embed the voices of young patients directly into planning and decision-making. The new Preparedness Union strategy rightly focuses on innovation and coordination, but lived experience must sit alongside policy and expertise. Young patients bring insights that cannot just be captured through reports. Second, we must invest in healthcare workforce to protect the continuity of care. Europe is facing a shortage of 1.2 million healthcare professionals. And as a medical student myself, I've seen firsthand what a stretched workforce means. Care is delayed or fragmented or harder to access. For young patients with chronic conditions, that uncertainty can be life-changing. And recruitment, but most importantly, retention of these professionals aren't just administrative details anymore. They're essential to our preparedness. And finally, stockpiling and communication must be inclusive by design. Between 2022 and 2024, EU countries reported 136 critical medicine shortages. Young people with chronic conditions cannot be last in line again. And it's not only medicines that were disturbed during the pandemic, it was essential routine appointments and rehabilitation therapies, such as physiotherapy sessions, were all disrupted. And who judged that these are optional in a time of crisis? In truth, they were not. It was just proof of systems that are simply not prepared. Therefore, preparedness must include transparency about what is available, fair cross-border distribution, and clear communication. But communication only matters if it reaches the people it's supposed to reach. And for young patients, we get our information through social media rather than traditional channels. And fast-moving media makes misinformation hard to control, so we must counter that. That means adapting our campaign strategies and ensuring accurate, reliable updates come from sources young patients already trust: accessible healthcare professionals, youth organizations, and active patient groups. These trusted voices must be embedded in Europe's communication systems well before the next crisis. I know our speakers today are already advancing on these priorities, and I'm very eager to hear their perspectives in the panel. If we want to measure recovery, we shouldn't only ask whether hospitals have restocked or budgets have grown. We should ask, have we built systems that actually listen? Have we built systems that young people trust enough to turn to during the next crisis? And as we reflect on recovery today, let's focus not only on how much we've rebuilt, but on how much we're building differently towards a Europe whose health systems are simply not just restored to where they were before COVID, but strengthened and reshaped by its lessons. Telemedicine, patient networks, and youth participation are no longer just temporary fixes. They're the foundations of a more resilient Europe. Young people are often called the leaders of tomorrow, but as you can see, we're active advocates today. We bring innovation, new perspectives, digital skills, and lived experience. Please engage with us now. Let our voices shape what happened next.
Thank you very much for framing this panel discussion so beautifully, Rata. Big, big message. We don't want young patients to be left at the back of the line. We want listening systems, and we want to rebuild the trust that has eroded in time and make sure that young people, young patients are part of the decision-making moving forward. Please do join us on the panel. Thank you very much once again. And I would like to invite Pierre-Yves, Marco, Georgos, and Willie to join us as well. And hopefully we've got Karine and Ole online. So great, and we have our online speakers as well. A special welcome to you, Karine and Ole. We'll be bringing you in as much as we possibly can. Yes, we can, loud and clear.
Oh, great.
Fantastic.
Hello.
Super. Welcome. So I guess a key question is, are we better equipped for crises today than we were back in 2020? And let's kick off with Georgis. First of all, at the beginning of COVID-19, member states often acted unilaterally on their own in isolation. And later, the Commission established HERA and promoted the concept, the agenda of the European Health Union. Could you describe a little bit that trajectory and how it unfolded? And today, do you see any major limitations or constraints with regard to HERA's mandate moving forward?
Thank you very much. Good afternoon, everyone. Let me start by thanking, first of all, the EPF for this Congress, of course, for inviting the European Commission and DG HERA to be present. And of course, most importantly, for all the amazing work it's doing for patients. I have to say that in my previous job as head of cabinet for the Health Commissioner, Commissioner Stella Kyriakides, we worked extremely closely with EPF through the most difficult times. So I saw firsthand myself, through a lived experience, the value added of the EPF for the patient space and, of course, for having resilient and healthy healthcare systems. Now, to say, in terms of answering the question that the pandemic caught us unprepared, I think is as cliche as some of the phrases on your bingo card. So at this point in time, I think we all know that all our systems were terribly unprepared. When the crisis struck in January 2020, we were unprepared in all respects, And we very quickly saw the manifestations of that in terms of the border closures, in terms of the disruptions in the supply chains, as we heard from Radu earlier, the disruptions also in healthcare provision. And of course, also, we were given a clear roadmap in terms of what we had to do as European policymakers to address some of those challenges. So the European Health Union package was, in a sense, the structural response to the first lessons of the crisis, starting first and foremost with the clear need we saw to reinforce the scientific agencies that were doing the frontline work for the European Commission and for the European healthcare ecosystem, meaning ECDC and DMA, but also, as you heard earlier, the reinforcement of this cooperation framework that we had, the Serious Cross-Border Health Threats Regulation, to make it, of course, more efficient, better performing, and allowing better coordination at the moments when the crisis struck, without ever discussing the treaties and, of course, the competences between the European level and the national level. But the most important thing that I was missing, and we saw that at political level as soon as the crisis came, was the absence of trust. The trust between the many different levels of governance in healthcare in Europe, but also the anticipation, the ability to work upstream to prepare for the next crisis, and if not to prevent it, at least to be in a position to respond to it better, but by having in place all the necessary components to respond to it. So that's how HERA, the Health Emergency Preparedness and Response Authority, was created in 2021. It was not an easy birth, let's say, in terms of the negotiations that we had to go through to set it up, but we are extremely happy to be having a seat at this Congress and to hear from your young members that it brings added value to the work that we do in terms of having resilient healthcare systems. Now, for us as HERA, resilience means access to medical countermeasures, and we measure this by let's say, the medical countermeasures that become available to our member states, much like COVID vaccines became available to all member states, all citizens, at the same time and with the same conditions in the European Union, but also, of course, in the hundreds of millions to countries outside Europe. So it is these tools that we have, of course, starting with joint procurement to get access to these medical countermeasures, but also going to funding and, of course, all the grants that we give to organizations that work in this space, but also through the investment that we make to support innovative startups to bring new medicines, new medical countermeasures to markets, but also through activities like the EU FAB project, which supports, of course, surge manufacturing capacity in crisis situations, another, of course, lesson learned of the pandemic. Now, since last year, we have, of course, the Preparedness Union strategy, which aims to bring this change of culture in terms of how we prepared, and also a very concrete manifestation of a new approach in terms of having all hazards, whole of government, and whole of society approach to today's health threats. So putting health security at the center of this broader preparedness and security equation, of course, elevates it to the status of a top priority, and it needs to stay there if we are to be better prepared when the next crisis comes. And I'm sure you will have heard many times, it's not a question of if, but when. So in terms of the core work that we do, focusing on the medicines that can be the solutions to the next crisis, we presented last July a new strategy on medical countermeasures with 17 flagship initiatives to have this end-to-end approach to medicine development, which starts really from the stage of R&D and ends at the point of sale to the patient where the medicine is administered. But now, in this equation, and I think it's going to be one of the key themes of this Congress, it's also a question of the trust of public opinion, of the citizen towards these medical countermeasures in an environment where mis and disinformation are rife, where algorithms decide how we are informed and what we are informed about. And of course, while this is an issue which goes far beyond the healthcare portfolio and far beyond the purviews of our respective activities, I think it's clearly something that we as healthcare policymakers, civil society organizations, need to be extremely active in and prioritize going forward in order to ensure that people are informed with fact-based and evidence-based information. They're not mis- or disinformed. And of course, as much as this is going to be an uphill battle, it's one that needs to be at the very top of our list. So to go back to our original question, are we better prepared than 2020? I would think that the answer is a clear yes, if we go back to what I said. Now, is there much more to be done? Absolutely, no question about that. I think we should not see preparedness in the area of health as either a sprint or a marathon. It is a continuous and uphill process that has no end. And I think we should all be well advised to see this as a continuous priority for all of us to be ahead of the next threat. But I think I can be fairly certain that meetings like this one and the collaboration they forge is exactly what we need going forward to reinforce this preparedness.
Thank you very much, Georgis. I think that's a very good overview with cautious optimism. And I like your analogy of not a marathon, not a sprint, but actually walking up those hills and mountains with a very clear direction of travel. Willie, let's keep on the institutional side of things. How did WHO Europe really support member states during COVID-19? And given that the pandemic is relatively recent, it's interesting to see the current disengagement in global health and perhaps public health more generally. I'd love to have your thoughts on that and what are the kind of mechanisms that could be put in place to actually sustain commitment and accountability, etc., between crises.
Yes, thank you, Nicola, and also on my behalf and on behalf of WHO, thank you for the invitation and also welcoming the voice of patients in the discussion. And indeed, COVID-19 could seem long ago, 5 years. Actually, it's not, it's only 2 years because the official end of COVID-19 was declared in 2023. But it may seem that we want to easily forget about what it costed in terms of lives, but also in terms of economic productivity loss and also for our personal lives. Back then, actually, I was working in the regional office of WHO in Copenhagen for Europe. You know, WHO is structured along 3 levels: the global level, the regional level, and then the country level. And while Geneva, the headquarters of WHO, was organizing and coordinating the global response to the pandemic, at the regional office, basically we were scrambling to support countries in addressing the crisis. Actually, a few days after the pandemic was declared as a public health emergency of international concern, the new regional director was sworn in. And so everybody had to really scramble and reprioritize to actually support countries. And that was happening at different levels. There was the emergency support, of course. We had incident management teams. We were organizing deliveries of critical medicines. We remember that there were no personal protective equipment. There were not enough ventilators, etc. So WHO was helping to actually get those supplies distributed. When finally the vaccines came, we had the COVAX program, which assisted in distributing vaccines, especially to countries who couldn't afford buying them. But also at the regional level, we had the COVAX Plus program, which was a kind of matchmaking platform to actually bring vaccines from countries who had purchased too many vaccines to those who actually had too few. We provided technical guidance on infection protection, for instance. Many webinars and workshops were organized. But I think one of the most important elements was actually to help strengthen health resilience, because as Erato said in the beginning, actually health systems were crippling, were struggling, and especially the health workforce. So one of the focus was actually how can we support the workforce? And one element that was very important, that was mental health. And also for the youth, this was an important new focus. And this has become an integral element now, I would say, of the way how we prepare ourselves for the next pandemic. So the importance was a dual track approach. While on the one hand, health systems had to deal with the COVID-19 pandemic and manage the crisis. At the same time, as Erato was saying, there was a disruption in routine healthcare service. So I think for the future, in terms of preparedness, this dual track approach is really key, that we not focus only on managing the crisis, but that we also keep our health systems open. And in that sense, at your second question about are we better prepared now, I think
Quite briefly, if you don't mind,
institutionally, we are. We have also now a pandemic agreement. We have set up new mechanisms. But I think in terms of our healthcare systems, they have not really recovered yet from the previous shock. And they are not ready to, I would say, to address the next crisis. So that should be our concern. And especially this is happening in a new geopolitical situation where global health is increasingly under pressure. And we saw already that countries were deprioritizing health even before the COVID pandemic had even actually ended. So we really need to push on that political agenda. And I think organizations like EPF are very crucial in that. I think there's no in-between crisis anymore. We are living a stage of perma-crisis where one crisis comes after the other. And also we have a state of polycrisis where one crisis amplifies another one. So I think this is the new normal that we have to deal with. We have to deal with managing old threats like AMR, which was mentioned, like non-communicable diseases, but at the same time we also have to face the new threats like the effects of climate change, which is already happening now, and we already see the impact on our health systems. And of course the mental health crisis. So I think in that situation we really need to embed health systems in our preparedness strategies. And I think and I would also like to mention the EU and the collaboration that WHO has with the EU was really crucial also in making sure that the European Health Union was not a health union that was only protecting citizens within the European Union, but that also in the broader European region, in countries like the Eastern Partnership countries, Western Balkans, also we could ensure a better protection.
Great. I'm going to stop you there because I think the other elements we can introduce as we're looking towards moving forward. Thank you very much, Willie, for a very clear perspective on the enormous challenges facing WHO at many different levels and how you came together to address those. Thank you. Shifting gear a little bit, I'd like to move to Karin. You led COVID trials. How would you describe Europe's clinical research ecosystem during the pandemic? And could you share perhaps a couple of examples of how this has evolved since 2020? Over to you, Karin.
Yeah, absolutely. You hear me?
Yes, very clearly.
Great. Okay. At the beginning of the pandemic, we clinicians have been totally overwhelmed. We were ready for a big tide. We got ready over a few weeks for a big tide, but in fact, we got a tsunami. And you know that in clinical research, that's the clinicians who are including patients in trials. So when we were fighting, to save lives and try to do our best in the hospitals, not to get totally overwhelmed, it has been a very difficult time to set up clinical trials. And that's where we saw that the European landscape for clinical research in infectious disease, and especially emerging infectious disease, was totally fragmented. We had to face a fragmented landscape in clinical research, except in some occasions, like with the platform trials of recovery in the UK and a bit with REMAP-CAP over Europe, but only in ICU. We didn't have a very well organized pan-European network for clinical research. So we had to build that in a record time with a lot of constraints on human resources and some constraints regarding money, for example. And we had to face a lot of issues. First, regulatory. procedures. In some countries, it took time to have a fast track to implement clinical research. We had a lot of problems with the templates for hospital contracts, templates with the industry, or templates, with just regulatory bodies, the national regulatory bodies. We also had issues with drugs, access to drugs, because it was a new pathogen. We did not have targeted drug for that pathogen. We could only evaluate repurposed drugs, and of course it's totally different when you use a repurposed drug for a pathogen or a disease when it has been developed for another disease. The regulatory procedure is a bit tricky. We also had some problems with diagnostic tools and unification of diagnostic tools across Europe. The third issue we had was around methodology, use of innovative methodology to have very quick results on evaluation of the efficacy of drugs. And at that time, it was not implemented everywhere. Data sharing also has been a huge issue across Europe. And finally, the fourth issue, I think, is probably how we dealt with the patients themselves and patients association, because we were in such an emergency that, from my own experience, I know that we have forgotten to include patients associations in the design of trials, and we have seen how it has been difficult to include patients in those trials where, they were asking for hydroxychloroquine. They would be willing to participate to trials, but they wanted to get only one of the drugs of the trials, and of course it's not clinical research, so it's really linked to the difficulties of communicating during the crisis time. And also we had to face a lot of disinformation, fake news, academia, which we were not really acquainted to as clinical researchers and infectious disease specialists before. So obviously it has changed, and I'm really happy to see that we have learned lessons from what we have lived during the pandemic. It has started during the pandemic, luckily, but then now it's amplified. The European Union has launched mega grants to fund clinical research networks across Europe. We have been lucky enough to get some funds through that call for a consortium called Proactive Response, in which EPF is involved, and thank you again for your commitment. But we are not the only one. There is another network which has been funded, like Pipeline, associated to the Penta Foundation for Children and Pregnant Women. There are other initiatives for outpatient targeting patients in an ambulatory setting, so outside the hospital. And we are all now working together, trying to make things easier, to anticipate exactly what we have been saying since the beginning, trying to anticipate, because we think that we are in an inter-crisis mode, but you are totally right. The two speakers just before me said that we are always in a crisis mode. We are just trying to navigate through those crises, health crisis, global crisis or regional crisis. So it's a lot of work, but I'm getting more optimistic now.
Fantastic. Good. And we'll talk a little bit about the impact of your project and what you'd like to bring in terms of this misinformation a little later in our conversation. Marco, many patients with chronic conditions reported delays, interruptions in diagnosis and treatment as a major impact, and EPF did a lot of work around documenting some of this. How did you witness this as an individual, as a leader within a patient organisations, and what are your thoughts on the changes that are needed in terms of improving on continuity of care?
First of all, thank you very much for the invitation and congratulations on an excellent event. When I was starting to get to the room, I met all the familiar faces. We were discussing what is going on now, and I really didn't want to go into the COVID mode again. But when I was listening to the previous speakers, I went to my room where I was in, I went to all the phone calls I was part of, and it was basically of the problem of the disruption of the continuity of the care of the chronic patients. So patients had a really big problem. Are they getting the right medicines? Will they be available? So they were calling all around. And as a patient community, we saw our role there as helping the crisis. But it felt like we were like pushed away a little. So during that time, the continuity of care, this is one, so just two big messages. One is continuity of care was disrupted. And this is a problem for all the chronic patients, all the rare disease patients, all the patients who are on any kind of prophylactic treatment. And the second message that should be is crystal clear is trust. So this is something that came later. So later, after the COVID crisis, we saw lack of trust in the healthcare systems because of the way that we together managed the crisis that came. So let's see some of the good things. So telemedicine is something that we have embedded in our healthcare systems now. It was never done before. I don't know, it was done in a smaller scale. I know many friends of mine, and also you probably know what is online meeting and how to participate online with the conference. I do not remember that prior to COVID conference, we had a conference with the speakers that would be there online. But we learned that, and it's a good thing. So one positive side. The second positive side is cross-border collaboration. We as patient community, we saw that we have like now European Health Union and also HERA that are working very well in collaboration cross-border in regards of how to establish a network for that. And the third part I would really like to emphasize, which changed, is risk communication. It seems that we are building up systems that will be better equipped to communicate risk to the patient communities and to the general public. But overall, we still have problems. So we have problems with accessing to the right care, even between the countries and even in the countries. It's really a big thing if you live in a big city or you live in a rural area. So what can you expect from a healthcare system can be very different. So these are the parts that we still need to work on, but I will go into the details later.
Very good. And again, the solidarity and the unity of patient organisations during that very, very critical time was super important. Ole, I'd like to pose a similar question to you from a doctor's perspective. What's your assessment of the preparedness of healthcare systems in 2025 compared to 2020?
Good afternoon. Thank you very much for giving us this opportunity. And I'm sorry not to be with you in person due to cancelled flight. Just like to, as an introduction, say first that much of my personal experience from the pandemic is as responsible for public health manager at community level in Norway over those years, with very much the aim by many means of reducing the influx of patients to overcrowded ICUs and other hospital services. And our experience shows that the importance of trust, as a former speaker also pointed out, and management of crisis close to the population cannot be underlined strong enough. We as European doctors, we have learned a lot from the pandemic. However, there has been too little political action to translate these lessons learned into better preparedness, in particular when it comes to the health workforce. At EU level, we feel the European Health Union legislation did not go far enough, and the European Health Union is still very much under construction. However, steps forward or towards improvement in preparedness have been made, in particular in the area of pharmaceuticals and e-health, and we continue our work to make Europe more resilient, as evidenced by the adoption of critical European initiatives such as the European Health Data Space and the ongoing negotiations towards a critical medicines act. But we must also highlight that critical European capacities remain fragile. Among many possibilities of improvement, 3 key ideas can be highlighted. First, we observe a chronic shortage of doctors and nurses in Europe. Burnout and aging medical workforce, deteriorating working conditions which push healthcare professionals to leave are now some of the largest threats to preparedness. Health systems require an adequate workforce to ensure high-quality care can be delivered during day-to-day service delivery, as well as during crisis. Secondly, chronic underfunding of healthcare is a significant barrier to improving preparedness for the European Union. Without reliable long-term investment, we risk being unprepared for the next major health crisis while struggling to cope today's challenges. We need a dedicated funding program for health, which is given the same strategic priority as spending on defense, for example. And thirdly, supply chain is finally becoming an increasing challenge for Europe's preparedness. Despite our progress, Europe remains highly dependent on third countries to produce its key medicine and its active pharmaceutical ingredients. So, and finally, I would just like to add that much of crisis management and countermeasures are done at local level. To our experience, the local public health capacities and ability to scale up for crises that last over time is not at the level that we managed to create during the years of the pandemic. It has been taken down. Medical countermeasures, for example, without a resilient health workforce to deploy these measures is of limited importance or effect. Thank you very much.
Thank you very much, Ollie. So the importance of the local dimension, workforce, underfunding, etc. You've outlined a number of key topics that will probably go through this conversation and indeed the Congress itself. So turning to you, Pierre-Yves, we all know how critical testing was during the pandemic and the need for accuracy and precision. From an industry standpoint, from your industry, what were maybe the 2 or 3 key lessons that you learned from this period that can actually help to buttress and support preparedness moving forward?
Thank you for having me here. I'm very grateful to be at the Patient Forum because we really feel as industry that the relation with patients can always be improved, and it's super important for us to design the products, to use them. Here I'm talking on behalf of MedTech Europe, which is the trade association of medical devices and in vitro diagnostics. But at the time of the COVID, I was myself working in Belgium for selling PCR tests, who no one knew about before the COVID crisis. Mm-hmm. So the COVID crisis was great because it shined a light on our industry and what we can, how we can support basically the healthcare systems. But it also shined a light on the things that were not working properly at that time. In regards to the product development, I think that the university hospitals, the laboratories, as well as the industry was pretty fast and reactive to develop those PCR assays to detect the COVID. And pretty much it can be done fairly quickly. Within the first weeks already you could find PCR tests. The quality of those were maybe not the best at first, but it was improved in the future. And some member states were pretty fast into giving access to their patients for these assays. Now, European-wise, there is the in vitro diagnostic regulation, which is a framework that ensures the best quality and safety for patients. And it is essential that our companies operate in this framework. I think it could still be improved, and there is a revision of this framework of this IVDR that is happening. The text will be published end of mid-December, somewhere like that. So we hope that Europe will make even faster framework for emergency cases or pandemics like the COVID. But certainly one blocking point when developing a test for a crisis like that was access to patient sample. We have biobanks, but for emerging pathogens, they are not so useful. So definitely having a clear framework for a collaboration between the hospitals and the industry to share with transparency and ethics those patient samples would be really useful to improve and further increase the access to those tests to the patients. On supply chain and manufacturing of those tests, as you know, the hospitals were screaming for having more tests being available for their patients to treat, to detect the disease, but also to guide the therapy. I believe that there were huge bottlenecks in raw materials in our industry, which was a big issue for giving actually those tests to the labs that needed it and to the hospitals. And you know, we live in a global environment where everyone on the planet has access to those same raw materials, and some countries have been retaining those and been very protective over those. And one role that we expect from Europe is to further incentivize, let's say, the regional manufacturing of those essential elements, so that there is local access and that we can prevent this protectionism from other parts of the world. All this so that we can supply our patients in the case of a crisis. So I believe that's the key elements that we learned during the crisis.
Fantastic, very clear overview. And I remember some of the conversations EPF were having with trade associations at the time, and the statements that industry actually gave and their commitments that they gave in terms of actually trying to put safety, trying to put access front and centre despite the challenges that were presented. So thank you for giving us a little bit of a glimpse on what it was like on the inside. So back to Ollie, you've already talked about the challenges, particularly in relation to healthcare workforces. In order for the healthcare workforce really to be ready for the next crisis, what could be the one big action we need now to achieve this? What would you say if you were to really prioritise one big thing?
Well, thank you. Looking ahead, healthcare professionals will only be ready for the next crisis if health systems invest in combating workforce shortages and ensuring safe staffing levels for healthcare professionals, coupled with working conditions which promote retention. The pandemic demonstrated that health system resilience during moments of crisis depend on a protected, well-supported workforce that has the capacity to scale up to the needs of periods of crisis. In addition to action addressing workforce shortages, investment in training programs targeted at healthcare professionals will also help to prepare for future cross-border health threats. This must be financed for all healthcare professionals, regardless of their attachments to health authorities. And cross-disciplinary training can facilitate the collaboration among various disciplines involving in the implementation of medical countermeasures, ensuring cohesive and coordinated responses to emerging threats. CPME highlights that training of doctors and other healthcare professionals is essential for the adequate deployment of medical countermeasures. They must have knowledge and skills to develop and implement the national preparedness plans and implement activities to strengthen crisis preparedness and surveillance capacities. So both the capacities and the training are very, very important measures here. Thank you.
Thank you. And moving back to Karin, again, you've talked a little bit about the PROACT EU project. Again, looking forward, looking towards the future, optimising preparedness, what are your thoughts on really making sure that the public research innovation environment is robust as it possibly can be? And if you can be brief in your answer, time's moving on and we want some questions from the audience. Go ahead.
No, absolutely. So what we have tried to do with PROACT EU response is first, we do not we did not build from scratch because we had already the beginning of a network called EU Response, which had been funded by EU during the pandemic. So we built on that network. We have strengthened the clinical site network. We have also given more power to methodology and trialists. We have also enforced the response around virological devices and all the diagnostic tools. And we have also set up a very strong social science component, including community and patients associations, in order to provide a clear understanding on how we should act with patients, for patients, in order to be better prepared for clinical research in the context of a pandemic. And I think that what we have learned from the last pandemic is that we need to be prepared and we need to be coordinated. And working on that global coordination is one of the biggest challenges and biggest achievement that we would like to reach with with proactive response.
Fantastic. Thank you very much. Pierre-Yves, obviously self-tests were super important during the COVID time to limit transmission. Thinking forward, self-tests, patient empowerment, patient information, how do you see you harnessing some of the positives during COVID in relation to self-tests moving forward?
Once again, the COVID crisis was great for making an example of how the tests, the IVD tests, can be used widely. And diagnostics are a great tool for early detection, for guiding therapies, for informing public health to take the better decisions for their people. Self-test is certainly a tool for empowering the patient themselves. I think that's where the industry can improve certainly is into communicating what to do with the result of a test. Is it to consult a specialist? Is it to go to the hospital, to isolate? These are to be done conjointly with the public health decisioners, of course. But I think that there was a lot of misinformation on also the tests, how they could be used and what they meant. This is not the role of the industry in general to educate to the best all patients, but I think that together with patients' associations, with the public health, there is certainly better to do to explain to everyone how they can be better decision makers for their own health and also for the public health. I think that it's a great chance that we are now in between crises, but it's where we should actually put more effort into educating the patients how to better test themselves in some situations. So we hope that when the next crisis happens, the right tool will be used in the right setting, in hospital, outside of the hospital, by the patient themselves.
Great, so that's looking at patient empowerment at micro level, but there's also a real role at macro level. Thinking about the role of patient organizations in fostering a culture of preparedness. Marco, how do you see that? And what are the key enablers for patient organizations to play this vital role?
So thank you for a very easy question. But, you know, we are facing more and more asks for providing a patient advocate to some kind of a committee or so this is a step into the right direction. So we need a systematic inclusion of patient advocates, but it needs to be regulated by law, because we notice that if it's not regulated by something, they will just forget about it, or you will just be part of the meeting as ticking the box. So to go out of the box, we need a systemic funding that will provide a patient group's possibility to grow patient advocates who understand the system and can, for the beneficial of every involvement of every stakeholder, they can chip in what they know. So the question is, what do we bring to the table as patients? So we bring lived experience, and we bring what is happening with the policy in real life. So we bring a policy, a law, and as patient communities, we know what this exactly means. And this is one thing that we bring to the table. So systematic inclusion of the patient advocates. Second, so if we are building up preparedness for the next pandemic, this could not be on the ad hoc budgets. So it needs to be a systematic funding for this purpose. And the third one is access to the data and information. So the trust was lowered during or after COVID crisis because patient groups were rarely included into the briefing of the general public. So we would like to have access to the real data in order to transform the information to be beneficial for patients, patient groups, and all the parties that are important for the general public to know this specific data.
Great, very, very clear perspective on moving forward, yes. and the crowd liked your response, clearly. Moving back to you, Willie, very, very briefly, because we'd like to have some questions. The infodemic, unfortunately, did play a role in undermining public trust, and perhaps an aspect of this was because community engagement was a bit piecemeal, a little bit ad hoc, rather than systematic in preparedness planning, and we're hearing that, I think, from a number of colleagues. So how can we combat misinformation, disinformation in the future, and what do you believe, from a WHO perspective, to be the role of civil society organisations, as I say, in a nutshell, because we want some Q&A.
Absolutely. I think, first of all, misinformation is not new. It existed always. But of course, with social media, it has amplified. Also, the good news is that most of the people still trust their doctors, the health authorities. But there is this vocal minority that can actually harm trust, but also harm cost lives, because we have seen, for instance, in the United States, it is estimated that more than 200,000 people died because of wrong information around vaccines and treatments and so on. So I think we have to really take this very seriously. And I think also in our preparedness plans, we have to embed from the start infodemic management. And as you say, and as Mark was also referring to it, I think the patient organizations, civil society more broadly, has an important role to play also in the co-design of communication. Because I think we have to balance between, on the one hand, evidence and empathy on the other hand. So evidence, we have to stick to science. This is not negotiable, I would say. We have to really keep the evidence as our compass for going through crisis. But on the other hand, we have to also understand that there are legitimate concerns, questions, and so on, and we have to address them with transparency, but also involving organizations like patient organizations as trusted voices to really counterbalance this misinformation.
Sure, and I guess the WHO resolution on social participation and all the dimensions of that is an important backdrop for that to happen much more systematically moving forward. Great. Karen, I'd love for you to just jump in very quickly, because I know that addressing misinformation is a really important pillar of PROACT EU. Just in a sentence or two, what will that actually result in very concrete terms? What will be the deliverables in EU parlance?
So in 1 minute, 4 pillars. First, we are building a who's who in communicating around science for the community. Second, we are working on understanding the mechanism under disinformation through a global survey across Europe. Third, we are working on an IT algorithm to identify weak signs of emerging fake news. And fourth, we are working on the training of patients and citizens, and that's what we are doing with you, partly, EPF, for patients and citizens in a view of empowerment toward their own health and decisions, and being able to take decisions regarding their health in a period of crisis.
Great.
Very great.
Super. It's good to see very, very concrete outputs in relation to addressing this phenomenon, because it is, as Willie highlighted, incredibly damaging and costing lives. So, Georges, back to you. You mentioned the European Preparedness Union strategy, and it makes extensive reference to the concept of whole-of-society engagement, which is defined as an inclusive culture of preparedness and resilience involving multiple stakeholders, including civil society. So how do you think this concept can really be applied in practice in the EU institutions as they advance their preparedness policy moving forward? How can this actually be translated into reality?
In a nutshell, we exist as European Union to add value to the work of member states and to complement their efforts, particularly when it comes to crisis preparedness. So to put it very simply, whole of society means all hands on deck. And it's of course extremely important in this effort that civil society organizations representing citizens are really part of this effort. If we take the organization that I work for, DG HERA, we had the participation of civil society organically built into the DNA of HERA through the creation of the Civil Society Forum, which has been active since day one. Now, next week, as a matter of fact, we have the first meeting of its second mandate. I was really happy when I walked in. The first person I spoke to from EPF told me that they will be there next week when we have the first meeting of this second cycle. So that's absolutely essential to every preparedness effort. And of course, I'll take the example of mis and disinformation. Unless we go to the very local level and we engage with community leaders, with religious leaders, really the high street retailers, to educate them about fact-based information, we will not fight the disinformation that we encounter when it comes to healthcare on social media. So unless we work with civil society, I think it's absolutely impossible to be prepared for the next crisis. That's point number one. Point number two, unless we work across silos when it comes to policy, and we only need to go back to the early days of the pandemic, and you heard plenty of examples from this panel of how areas outside healthcare were so gravely affected by the complete breakdown of the first few months in our economies and society. So unless we work across silos, so that's the whole of government part, in addition to whole of society, we cannot be adequately prepared. And I should say once again that civil society is really a pillar of this effort. Thank you.
And I guess to Marco's point, civil society needs to be properly resourced to be able to play that indispensable role as well. Good. Can I open up then for questions? You've been listening intently for the last, half an hour, 45 minutes or so. Please, it's over to you. I'd love, we've got a few hands. Before you pose your question, can you please just give your name and your organization so we know where you're coming from, so to speak, please. The floor is yours.
All right. Hello, my name is Sheila. I'm a rare disease patient advocate, and I am based with PIC United. My question is the following, which nobody mentioned, but I think it's very important. Nobody mentioned this tool. How will AI impact or influence preparedness for the next pandemic? And how will it impact patient engagement? Will it be in favor or not? And we know that this is also going to create a lot of misinformation. So how are we all going to tackle this?
An excellent question, Sheila. Who would like to take it? Any volunteers? I'm going to go to Pierre-Yves.
I was surprised not to see AI earlier. It's everywhere. It's embedded in the product development of most of our members. They developed AI products. They use AI to develop products. In what I know the most, diagnostics, it can be a great tool for having algorithm able to detect sooner or better than a professional alone. There are frameworks for developing, once again, under the regulatory framework that we have, good quality products with patient safety at the end that is preserved. So that's the very operational part of AI that is linked to, or that will be embedded, or is already embedded in the products. It is already comprised in the regulatory framework, so it is made in a qualitative manner. And it has been designed for the professionals. I don't have examples of AI yet in the hands of the patient in terms of medical devices or IVD diagnostics, but That's a good question. And I will stop here just for the scope of the product.
Very good. I'd like to actually perhaps go to Karin first and then come to you, Willie. Please, the floor is yours, Karin.
Yes, absolutely. So you're right. I didn't mention AI, but it was totally embedded in my thoughts when I talked about innovative methodology to analyze data in clinical research. We are using AI every day in our consortium, and especially with methodology, designing clinical trials, etc. And we are also using AI in our disinformation work. When I told you about identifying the weak signals of fake news, we are using AI. So, I mean, it's already tools totally incorporated in the development of our deliverables in the consortium, proactive response.
Thank you, Karin. Willie?
Yeah, just briefly, I think the potential of AI is enormous in all aspects of healthcare. Actually, last week we had a conference in Malta on how it can be applied in healthcare and how it is already applied in healthcare. Also, when we talk about the health workforce crisis, AI has to be embedded, but it means also that we have to train health professionals to work with AI. And last but not least, we also need to build the trust, because if patients don't trust AI, then it won't work. So I think we cannot leave AI to the experts, to the AI experts. We should all be engaged in building governance around AI so that it can be trusted and that it can be useful and usefully used in healthcare.
Mm-hmm. And indeed, patient leaders are also becoming experts in AI because the opportunities around AI for streamlining, for actually enabling patient organizations to focus on their core business and get AI to support administrative stuff, et cetera, is really clear as well. Oli, you wanted to come in.
Oh, yes, thank you. I completely agree with the last speakers, and especially the latest one, when it comes to AI and the use of it. But if we imagine that a new crisis will be a pandemic, AI will certainly have a role both when it comes to the healthcare professionals' follow-up of their patients, but also the patients' follow-up by themselves. I mean, AI is closely linked to medical devices, to their own personal care, and how we can use this information to actually follow up more patients with the higher productivity than we would have managed without. Thank you.
Thank you, Oli. Georgis, very, very briefly, and then we'll move on.
Very briefly, in the area of health preparedness, AI has a critical role also to play in terms of modeling epidemiological curves on the development of a pandemic, but also crucially on the development of medicines, medical countermeasures to address the emerging pathogens. So certainly a massively important development in this area.
Great. Good. I think so. Florence's hand. Do you want to come? Oh, you've already got the mic. Please, very brief question. Introduction and brief question.
So my name is Florence Bertaletti. I would say I'm a public health lobbyist working at EU level for the past 25 years. Some of you have mentioned that actually our healthcare systems have not yet recovered. The NCD crisis, 80%, the climate change, also the lack of investment in the healthcare workforce. I would say that today our health systems are worse off than they were 5 years ago. There is a strike, and our doctors and nurses are actually striking because there's a lack of investment in public, in healthcare because of austerity measures. The WHO funding has been, hit. If today we had a crisis, the WHO doesn't have the capacity that it used to have. Civil society
Could you get to your question?
is being dismantled, and the last thing is that health inequalities have grown. So my question is, how do we not, A, support the strike? Do you support the strike? And secondly, shouldn't we say very clearly that we need investment in our healthcare systems right now? Because actually there is less investment than in the past.
So it's almost a cry for help, absolutely, Florence. So who would like to take this question? Obviously there was some something directed to WHO's preparedness. Maybe, Willie, you could say a couple of words on
I can
that.
only echo what Florence says. It is indeed a political issue that, as I said, health is being deprioritized because of other priorities, and so I think, I mean, also WHO is been hardly hit with big cut in our budget, and colleagues actually are currently leaving or have to leave WHO because there is not enough funding. So yeah, I think we have to look how we can build health system resilience towards the future, and that will also mean investing in health. And of course, at the European level, we are already talking about the next MFF, the next 7-year budget of the EU, and how health will be featuring in that budget. So that's one of the kind of battlefields, I would say, where we will need all hands on deck to make sure that health is not being disinvested in.
Yeah, and talking to you as Willie rather than a WHO representative, since you're from Belgium, the question very directly posed by Florence on the strikes.
Yeah, well, as a WHO representative, I don't
you
take any
can't,
questions on
but as
political
Willie you can.
issues. No, that's no, I think clearly there has to be, the governments are disinvesting in health, in official development aid, etc., and that has consequences. So we will need to deal with that.
Mm-hmm.
Yeah.
Marco and then Ollie. Marco and then Ollie. I'll bring you in first, Marco, please.
So I will be very brief. I like simple analogies. You know, if you cut yourself and you think that time will heal the cut, it will take a long time, and sometimes it gets worse. So we are in the same state now. So something happened to the healthcare systems, and now we are slowly moving budgets away from that, thinking that it will heal itself. But maybe it won't. Sometimes we forgot who are the people who put the people in the position that they have to take a vote on our healthcare systems. It's us. So as patient community, we have the obligation to go to the people who run for the office and check what do they have in place for health. Is the health thing big enough, or are other topics on the agenda bigger? So, and then let's try to build up this again from the ground up. So let's think who are the people who put the persons who are decision makers in place, and what do they have to offer for health? Because yes, I do agree, if you cut the budget, if you lower the budget, there's nothing you can do. And even worse, it will get worse, not better. Thanks.
Thank you, Marco. Ollie.
Thank you, and thank you very much for bringing this question up. And of course, this is policy. It's very much in the competence of member states, and not that much at the EU level, probably. The unfortunate thing is that the inequalities, they will only rise if we are not prepared enough for the next crisis. Both inequalities within the society, within the country, but also between the countries for cross-border crisis. I've seen on television today that one of the questions about the strike actually in Belgium today is the rise of the age of retirement to 27 years. Sorry, 67 years. I think that healthcare professionals, they can forget about that. They will not be able to leave work or their profession at 67 or 70 years old if we do not solve this crisis. Thank you.
Thank you, Ollie. So sober words indeed. Please, do we have a microphone here? Oh. Okay, we'll take this one first, and I will actually make sure you have the next.
Thank you.
Please go ahead.
Good afternoon. I'm Rosa Castro from Eurordis, Rare Diseases Europe, and it's a follow-up question, so thank you, Florence. I'll keep it more focused. Because many of you mentioned some of the areas that have been always essential for the rare disease community, like cross-border collaboration, clinical trials across countries. I mean, there's nothing in innovation in rare diseases without that. Now, my question is, you also mentioned that there is not in-between crisis anymore, kind of thinking, because we live in a polycrisis, perma-crisis. But it is true that priorities are shifting. So the question is, how do we leverage the increased focus on competitiveness on other areas and the decreased focus on health? Even security is a big topic, but it's not necessarily about pandemics, it's other layer of security issues. How can we leverage as a community, or specifically patients, to make sure we retain the funding, to be ready to respond to emergencies the next time, and to build up on innovation too?
Georgi, I'd love you to answer that, please.
I could take a stab at this, and given that we are the owners essentially of the competitiveness agenda, the European Commission, I think your question is a very, very apt one, and it goes to the previous one also about investment in healthcare systems and the available funding for health. And I go back to 2019, 2020, when we proposed and negotiated EU for Health. Of course, that was quite a paradigm-shifting moment for the European Union. We increased the healthcare budget from 400 million for 7 years to 5 billion for 7 years. And of course, that was all in the context of a pandemic, which sets everyone's pants on fire in that negotiating room. Now, of course, that sense of urgency has passed. Many of us are asking for falling again into the same cycle of panic and neglect. But here we can take a view of the glasses half empty or as half full. If you look at the Commission's proposal for the next 7-year budget that we presented last July, you will see that there's funding for health in 3 big pots. One is, of course, the Union Civil Protection Mechanism / Health Emergency Response Program. Then there is the European Competitiveness Fund, which is a very big pot of money. And there's, of course, also Horizon Europe. Now, this reflects the current funding structure that we have in the area of health, where we had EU for Health, RescEU, Horizon Europe. So what is the lesson that we draw from this? For us, it's about investing in synergies. So competitiveness in the area of healthcare means innovation. It means bringing startups to the point where they can deliver products to market for patients, of course. That's always the product that needs to reach the patient, not just the market. But also in the area of security, in maximizing and leveraging the synergies that exist between defense and healthcare. Dual-use medical countermeasures, for example, that you use both in situations of mass casualty events or armed conflict, and also to combat cross-border health threats. Or going back to the competitiveness point and trying to straddle this interface between competitiveness and security, bringing companies to Europe to produce these products with dual-use purpose, so we can benefit both from the defense and from the competitiveness push in terms of the political attention. So yes, I think it's difficult for anyone to deny that health is no longer at the very top of the political agenda. But I think what we've learned from the last 5 years is that all of these synergies can really boost the healthcare ecosystem without directly targeting it.
Thank you. I think there was a little bit of an element of the question that was missed, but maybe you can have a chat over coffee on that one, please.
Yes, my name is Atife. I'm a cancer patient advocate with Aspire to Live. I've also started my initiative, Women Cancer Europe, since I survived the stage 4 lymphoma 2 years ago. I must first say I'm very grateful for the conversations I'm hearing, and I've been active in the field since my survivorship about 2 years ago, sorry. And it's the first time at a conference that I'm hearing real focus on patients with lived experiences. So I really appreciate that, and I can see that it's not just the talk. I can see it's integrated in your programs, and these are tangible results that I'm looking forward to see more of that. But given everything that was now discussed, I had a couple of points to make. One with the trust issue that we're talking and comparing that to the patient access to the AI tools to get the results, to get the answers. I think one important thing we're missing out on is actually backing and supporting our professional healthcare staff in being able to build the trust, because the majority of people actually first trust their doctors, and when there is something they are dealing with that they were not informed by the doctor or not really included in the discussion, then they go back to, for example, ChatGPT to get answers, and that is quite risky.
Can I ask you just to move very quickly to the point or the question, because
yes, of course.
time's moving on.
I'll cut 2 of them for later. I can discuss with you on the break. But The funding allocation, I think the funding and budget, I think we should be careful about the allocation of it and very much giving it to the civil society that can mobilize more patients. And the question on the regulation, how do you see that putting policy into a law, how can we hold accountability and how can we be sure that we are not over-regulating that would cut out some essential voices? Thank you.
Great. Who would like to respond? Please, Marco.
I will try to be very brief, but until the end of the year, we will finish the negotiation between the Parliament, Commission, and the Council in regards of new pharma legislation. And I do hope, as a patient representative, that the end result of this negotiation will be that we have in law what exactly patients are doing, for example, at European Medicine Agency, and do they have the voting right? Because if you work there and you have the voting right, they are taking you seriously and they consider the patient voice. I'm not saying that they didn't consider all the observers, but from the discussion, it was clear that the patient voice should be considered as heavy as a country, because a country has a voice, and now a patient will have a voice. So if you have something in law, there's a bigger chance that you will be involved and you have a meaningful engagement of patients on that level.
Thank you. Time has really raced on, and we have to, I'm afraid, one very, very last question, and it needs to be super quick, please.
Good afternoon. My name is Helen Bennett. I represent GAMI in Europe, which is a mental health patient organisation. You mentioned that there's a mental health crisis across the whole of Europe. What's being done about it? And it's notable there is nobody there representing mental health on the panel.
Good. I'd perhaps like Willie to say one sentence on that, if that's possible, and also Georgis, because I know there is a mental health strategy, please.
Yeah, there is, also during the pandemic, the Mental Health Coalition was established to actually engage with also civil society and bring all the actors together to strengthen also psychosocial support in case of emergency. So I think we have moved further, and I think that also now we see, for instance, in our European program of work of WHO, mental health is taking a prominent position in the prioritization of our work. So I think we moved.
Thank you, Willie.
I will not reply as DG Hera, but as European Commission official and as an old-timer in the area of healthcare. You said very correctly, Nicola, that we do have actually a mental health strategy in Europe. We presented it with my former boss in 2023, 2 billion euros supporting a whole series of flagship actions from across a range of policy portfolio. And now that strategy is still very much valid and active. And as a matter of fact, in the new commission, we were delighted to see that now there's a mental health mention or task in the portfolio and missions of several commissioners, including the Commissioner for Education, the Commissioner for Digital, the Commissioner for Justice, certainly also the Commissioner for Health. So that's certainly the legacy of the last Commission mandate, and of course the importance of the issue, the salience of the issue going forward.
Great, thank you. Look, we're going to close up now, but I do want to give everybody one single sentence, thinking about the workshops that we're going to have after the coffee break on antimicrobial resistance, environment and climate health risks, and budget pressures. Really big, challenging, wicked topics. I just want one sentence from each of you in terms of what would be the big action that you feel would prioritize over everything else. Oops, I'm losing my phone. Errate, first of all, please.
I'm going to talk about antimicrobial resistance because it's a thing close to my heart. I would say better regulations about prescribing, both on a national and international level, and also on a local trust level, because we need to control that in order to protect our patients that need the protection more. Example like chemotherapy patients and transplant patients.
Thank you, Errate. Please.
Having had a look at a lot of the startup and SMEs that are out there innovating in the field of AMR, there are a great lot of people that want to actually develop better tests to better inform the doctors whether to treat or not to treat, which antibiotics and so on. So I do believe that we have a superb network of companies in Europe that can develop amazing products. We need to support them the best to reach the market and the patients for the best use.
Thank you. Let's go to our online contributors first. Ollie, please.
Thank you very much.
Just one sentence, please. Thank you.
Yes, well, when it comes to AMR, I think that we have to cooperate both between doctors, veterinarians, and others to reduce the use. We have to learn from those who have actually managed to reduce AMR, for example, in Nordic countries with competence and specialization of primary doctors where they prescribe 90% of all antibiotics. Thank you.
Thank you, Ollie. Karin.
Yes, so I think that for AMR, we should work on a closer partnership between medical science, veterinary science, modeling, clinical research with the community in order to better communicate.
Thank you very much. Georgos.
I would want to say all of the above because I agree with all the speakers, but I think the key, let's say, red thread connecting all these things is funding. It's money. So a strong call to action for your further reflections. Think of how you will speak to your finance ministers to make the case for more funding for health, for AMR, and of course for all the other things. Thank you.
Thank you. Willie?
If I can pick the other topic on budget pressures, which is also a workshop, I would say to pick one challenge, I think if we want our health systems to survive and to be resilient, I think we have to take prevention more serious. And prevention is not only playing at an individual level, we also have to see how the industries behind harmful products and their lobbies, how to face them and how can we actually make sure that people can have healthier lives.
So commercial determinants.
Yeah, commercial
Very good.
Determinants.
And the last word goes to you, Marco.
Yeah, let's try to do it in one sentence. So patient group as a co-partner, together with Commission and national authorities, building up systems where continuity of care will not stop even if we face the next crisis.
Thank you very much. A big round of applause to our excellent panelists. Also to our panelists online, your contributions were fantastic as well. I believe EPF has a gift for those here in the room. And we go back to our wonderful masters of ceremony, please, to give us some more information about what happens next.
So thank you very much to our esteemed speakers for this wonderful conversation. I think we all took quite a few key takeaways from this conversation. So coming up now, it's time for you to have a quick refreshment outside. The coffee break is just going to be right where we had the lunch. So please feel free to take some. Yes, in the lobby. Something that I really quickly need to mention is that there is a small typo on the bingo sheet, and it's actually the first 10 winners who are going to receive a prize. So the first 10 to complete the bingo have to go over to the registration desk and receive their prize. I saw a few of you already have quite a lot scored out, so I have my hopes up. But yes, that's it. And then you have to cross off all of the squares. That's the big bingo announcement.
So after the coffee break, you'll head to the workshops. It's listed here where you need to go. So workshop 1, it's from 3:45. So from workshop 1 is in Sycamore Ballroom, that's here. Workshop 2 is at Buckeye, and 3 is in Chestnut Room. They're all on the first floor, so you head out here to the end of the lobby, up the stairs, or use the lift.
And you can see which workshop you're registered for on your personal agenda, on your badge. If you have any questions about the workshops, you can find one of our EPF staff members with the blue landline, and they're going to support you and help you where exactly you need to go. Something very quick again, because we don't have any time left, is to please don't forget to show your photos with the hashtag EPF Congress 2025. It's not 25, it's 2025. So correction on that part. And yeah, see you all after the workshops. We'll be waiting for you back here in the big room at 5 o'clock sharp, please.
Enjoy.
Thank you all. Thank you.